Hi, my name is Dr. Olajumoke Megafu, and I'm a general surgery resident at the University of Massachusetts and a fellow of the Society of Black Colon and Rectal Surgeons. Our society is dedicated to mentoring, supporting, and promoting the growth of colorectal surgeons nationwide. We are committed to advancing colorectal health equity in underserved communities and increasing diversity within our field. One of the ways we hope to advance health equity is in increasing awareness about colorectal cancer and its symptoms, educate on how to prevent it, and encourage screening. Colorectal cancer ranks as the third most diagnosed cancer and is the second leading cause of cancer related death globally. In the spirit of March being Colorectal Cancer Awareness Month, here are answers to commonly asked questions about colorectal cancer from some of our surgeons.
Hello, everybody. My name is Dr. Izzy Obohare. I'm the Associate Professor of Surgery here at Texas Tech Health Science Center in Amarillo, Texas. And I'm also the Associate Dean for Faculty Development. But today I'm talking to you about colorectal cancer. And colorectal cancer is something that affects every one of us. If you have a colon, you can have colorectal cancer. Now, colorectal cancer has a higher incidence in African American compared to the whites, simply because of social economic factors as well as environmental factors. There's a 20% higher incidence of colorectal cancer in blacks compared to whites. And what we're finding out is colorectal cancer is occurring at a younger age. Now, the current screening guidelines for colorectal cancer is by the age of 45, you should get a colonoscopy for the general public, for those that have average risk. However, if you have a family history of colorectal cancer or you have a personal history of polyps or symptoms, you want to get checked early. Talk to your doctor, talk to your provider, and your insurance will pay for it to get screened early. What you don't know can hurt you, because if it happened to Chadwick Boseman, the Black Panther actor, it can happen to any one of us. So go ahead and get checked. Colorectal cancer is not just a man's disease, it affects women as well. If you have a colon, you can get colorectal cancer. So as awareness for March, which marks Colorectal Cancer Awareness Month, our goal is to reduce the incidence of colorectal cancer because it's preventable, it's curable if found early. Get checked, get screened. I did it and you can.
My name is Dr. Irma Tanchu and I'm a practicing colorectal surgeon out of Northwest Arkansas. I fell in love with colorectal surgery as a third-year medical student when I was observing an abdominal perineal resection where rectum is removed for some patients that have rectal cancer. The complexity and the intricacy of the pelvis sparked my interest and has fascinated me since. I further got more interested in this field because of the variety that it allows me to have and also the wide breadth in patient population that I get to interact with. Is colorectal cancer preventable? Yes, it is. Which is one of the reasons why I became a colorectal surgeon, is the ability to prevent colon cancer by performing colonoscopies and removing precancerous colon polyps that if left alone would have turned cancerous. Is colorectal cancer curable? Yes, it is. For early stage colorectal cancer, it can be cured with surgery, plus or minus chemotherapy, plus or minus radiation in the case of rectal cancer.
Is screening necessary for colon cancer when there are no symptoms? Yes. The symptoms for colorectal cancer are usually very vague and include abdominal pain, vague weight loss, discomfort. Most of the time, patients present to their primary care doctors or to the ER with rectal bleeding that they attribute to hemorrhoids and have no other symptoms. Other times, patients have no symptoms at all and are found to have colon cancer on a screening colonoscopy well before the disease has spread. Even in those instances where it has spread to other organs such as the liver and the lungs, patients may have no symptoms whatsoever. So yes, screening for colon cancer when patients have no symptoms is necessary.
Hi, my name is Dr. Robert Amajoy. I'm a colorectal surgeon here in Kansas City. I am the director of rectal cancer program here at St. Luke's Health Systems, and I am the current president of the Society of Black Colon Rectal Surgeons. Colorectal cancer is common. it is deadly, and it is very, very preventable. It is the number 3 most common cancer in men and women. It is the number 2 most common cause of cancer-related deaths in men and women. Even though it is largely preventable, still yet, only 1 in 3 Americans have been screened. Till today, there's still confusions on the screening age. The number is 45. Write it down somewhere. That number again is 45, not 50. If anyone tells you that 50 is the screening age, kindly remind them that the screening guideline has changed. One important distinction to make is understanding the difference between screening and diagnostic colonoscopy. Screening colonoscopy is for those with no symptoms, those average risk individuals with no family history of colorectal cancer or any other risk factors for colorectal cancer, those that are age of 45. While diagnostic colonoscopy is for those who already have symptoms such as rectal bleeding or any other changes in bowel habits. If this helps you, I am turning 45 in the next year. I'm excited because I get to get it done. I can't wait to get it done. It is right here in my neighborhood. It is right here in my backyard. The screening test is readily available everywhere in the United States. You should be excited about getting this done as well. Remember, that number is 45. Get screened. Thank you very much.
Hello, my name is Dr. Erin King Mullins, and I'm a colorectal surgeon in solo private practice at the Colorectal Wellness Center in the Atlanta area. I'm here with you today because I want to talk a little bit about, number one, why I became a colorectal surgeon and some important topics for Colorectal Cancer Awareness Month. I love being a colorectal surgeon. I deal with preventative care. I talk about nutrition and education with patients, but also if unfortunately a patient requires surgery for their colon cancer, I'm the one to do it. And so I love being a part of the overall care and treatment of patients. Now let's talk about some important topics when it comes to colorectal cancer awareness and screening. And a common question that we get is, hey, doc, I don't have a family history of colorectal cancer or polyps or anything. So do I still need a colonoscopy? And the answer is yes, a resounding yes. Okay. So only about 10 to 15% of colon cancers are linked to having a family history. So that means the other 80 to 85% just happen. So the number one risk factor is going to be age. So just like, women start getting mammograms after a certain age, men start getting their prostate checks after a certain age. We just have to start checking for bad stuff so we can prevent anything more serious from happening. So the important key, again, yes, we want to talk about family history and have those open conversations because that history can put you at increased risk. But your number one risk factor is age. So always talk to your provider about when it's appropriate to start getting screened.
We hope you found these answers to commonly asked questions useful. To learn more about colorectal cancer and what you can do to prevent it, or to ask additional questions, please join us at our upcoming webinar.